Hello and welcome to Down the Scope, and welcome back to this series on histopathology. In the last episode, we discussed the different types of necrosis and their histologic features. Now we're going to move on to the response to necrosis, that is acute inflammation. Clinically, you may have heard of the 5 cardinal signs of inflammation: redness, heat, swelling, pain, and loss of function. But you can't feel heat through a microscope eyepiece, and you certainly can't see direct evidence of pain on a glass slide. So as pathologists, we have to infer clinical signs from the histologic evidence. The redness component might manifest as congestion or hyperemia, while we can see the causes of swelling, such as leakiness of blood vessels signaled by edema, fibrin, and leukocyte infiltration. We're going to focus on a slide of acute bacterial pneumonia in a calf, with some references to normal tissue sections. The first stages of inflammation affect the blood vessels. There needs to be an increase in blood flow to the affected site and blood stasis within those blood vessels. On a slide, these changed hemodynamics might manifest as dilated blood vessels filled with lots of red cells, a change we would call congestion or hyperemia. Look at the alveolar capillaries in this section of normal lung. They're quite collapsed, although in some areas they contain a single file of red blood cells. But if we switch to the affected section of lung, the capillaries and other vessels are engorged and filled with tightly packed red cells. And you can see here, this is one alveolar capillary, and here's another alveolar capillary with the alveolar space, and these capillaries are packed full of red cells. You can also see some hemorrhage, which is defined as any red blood cells outside of a blood vessel. So all of these erythrocytes within the alveolar spaces, like this big dollop here, are hemorrhages. Blood vessels also need to become more permeable to allow fluid, cells, and other components from the bloodstream into the affected tissue. Endothelial cells contract, creating gaps between them and allowing fluid into the tissue. This is edema. In the example that we're using, I think the edema is best appreciated in the interlobular septa. Cows have very partitioned lungs. You can appreciate this both grossly and at low power on the microscope, with these bands of fibrous tissue separating globules of alveoli. These are the interlobular septa, and in this section of normal lung, you can see that they're relatively thin, made up of this moderately dense collagen. If we switch over to a section of lung which has pathology in it, you can tell that some of the interlobular septa are expanded. And if we zoom in a little closer, you'll be able to see that rather than having nice, evenly spaced bands of collagen, you've got this kind of more clear appearance. On H&E, water doesn't stain, so all we see is separation of the normal tissue by the edema fluid. It looks like this empty space, sometimes with a light pink tinge. In some areas, edema might be more proteinaceous and stain a deeper pink colour. I find this particularly true in the lungs, although this can be an artifact, especially in frozen tissue. The presence of foamy alveolar macrophages is often a reliable indicator of pulmonary edema. You can find them in quite high numbers, these large foamy cells in the alveoli of cattle affected by acute bacterial pneumonia. You might also see what's known as endothelial cell hypertrophy. During acute inflammation, endothelial cells switch on and become quite active. They become hypertrophic, which is the term for increase in cell size. This is particularly visible in the nuclei. To show you this, we're going to switch to a section of sheep brain with a Listeria encephalitis. Endothelial cells are squamous, so have quite flat, homogeneous nuclei in healthy tissue. So if we have a little look at, for example, these capillaries within the cerebellum, you can see that's an endothelial cell nucleus there, and it's quite flat. And again, over here's a blood vessel, and here's some endothelial cells with quite flat squamous nuclei. And for example, in this artery or arteriole here, We can barely see the endothelial cell nuclei. They're very flat. But when they become activated, the nucleus becomes much larger. You can often see it protruding into the lumen. So if we come over to an area of inflammation, this is a good example here. You can see the lumen of a blood vessel coming down, and then this endothelial cell nucleus sticking out into the lumen. This is a lovely example. So here's the lumen of a blood vessel with some inflammation around it. And you can see that little endothelial cell is quite hypertrophic with the nucleus sticking out into the lumen. And these ones are even more beautiful. Look. So here's the lumen of the blood vessel again, and 1, 2, 3, 4, 5 endothelial cells, really large and sticking out into the lumen. So that endothelial hypertrophy can be a really good indicator of inflammation. Water isn't the only component that leaves the vessels in inflammation. In severe inflammation, large proteins can also leak out, particularly fibrinogen. Outside the vessel, this turns into fibrin. The presence of fibrin tells you that the vascular damage is quite severe. So we're back in our section of calf lung with acute pneumonia. Now, this is a case of pasteurellosis, so a bacteria like Mannheimia hemolytica. These bacteria incite a reaction that produces an unbelievable amount of fibrin, and it looks like pink string or a messy meshwork of pink eosinophilic material. So you can see this alveolus here is filled with this meshwork of pink fibers. That's all fibrin. You can contrast it maybe to this slightly dippled eosinophilic material, which is maybe more edema. Certainly over here, I'd say that this is more edema fluid. And then this stuff here, this meshwork of pink fibers, is all fibrin. And you can look for its accumulation, not just within the alveoli or within the tissue, you can look for it in blood vessels as well. So here's a blood vessel, and there's a big clump of fibrin in the middle. So that looks quite suspicious for thrombosis, where the blood vessel becomes occluded by a blood clot. And often in these cases of acute pneumonia, you'll be able to find some quite convincing thrombi within not just large blood vessels. Here's another one with this lovely meshwork of pink fibrin within the lumen. It's attached to the vessel wall, so you can definitely call this one a thrombus. Oh, and just over here, you can see some thrombosis of the alveolar capillary with this fibrin. Another typical feature of inflammation is the arrival of neutrophils, also known as polymorphonuclear leukocytes. They're quite easy to spot, and seeing as we're in this interlobular septa, we can see some reasonably good examples here, although these ones are starting to degenerate. They're about medium-sized, so maybe about double the size of the red blood cells. They have relatively pale cytoplasm, and their most distinctive feature are these lobular nuclei. So you can see the cell here, and it has 2 lobes to its nucleus, and this one here looks like its nucleus is stretching out. So neutrophil will have a segmented nucleus with about 3 to 5 lobes connected by thin strands. It looks a bit like a string of beads or a twisted sausage or something. During acute inflammation, neutrophils move from the blood vessels into the tissues. How they do that exactly is the subject of another unlikely very long video. If you look at a dilated blood vessel, normally cells flow in the center, but during inflammation, neutrophils will move to the periphery of the blood vessel and then begin to stick to the side. These processes are known as margination, rolling, and pavementing. So this is a slide of a bacterial encephalitis in a cow. And if we come in on this blood vessel in the brain, here's the vessel wall, here's that hypertrophic endothelial cell, we've got some fibrin in the middle, and at the margins every now and then you'll catch a neutrophil. So this is probably a neutrophil just here, with its bilobe nucleus starting to head out of the blood vessel. These ones have already made it through the wall, and they're just in that space, the Virchow-Robin space between the vessel wall and the brain parenchyma. So they've managed to make it out of the blood vessel. And then once the neutrophils have exited the blood vessels, they'll form these massive accumulations within the tissue. So here we've got some bacterial colonies, and then surrounding them, there's all of these neutrophils. When you see this kind of mixture of neutrophils, some of them are alive, some of them are dead, like these ones with kind of faded nuclei, along with this mixture of necrotic debris and bacteria. This is what we call purulent or suppurative inflammation, and what you would see grossly as pus. Bear in mind that not all of these neutrophils really look like neutrophils. Some of them are starting to break up. Their nuclei are not quite as well segmented, and they just look quite messy. They're not long-lived cells, and they're all spilling their guts everywhere in an attempt to contain whatever it is that's caused the inflammation. In this case, these bacteria within the brain. Some bacteria even produce leukotoxins that directly impact the neutrophils. And when this happens, they develop a smeary nucleus. Looks like somebody has dragged their finger across the group and smudged all the nuclei in one direction. These are called oat cells, and they're a typical feature of Pastorellas, such as Pastorella multocida and Mannheimia hemolytica, as well as some other bacteria, such as Actinobacillus pleuropneumonia, that affects pigs. Neutrophils are one thing, but have you ever heard of a heterophil? If you're looking at a dog, cat, horse, or cow, you're looking for neutrophils. But if your patient is a bird, a reptile, a rabbit, or a guinea pig, the acute inflammatory cell is different. In these species, you have to use the term heterophil. These cells look quite different to neutrophils. Rather than having homogeneous, pale cytoplasm, heterophils are packed with large, pink cytoplasmic granules. And this is a section of skin from a chicken. You can see the nucleated red blood cells that are typical of reptiles and birds. And here are the heterophils. They're these, so they still have that kind of similar size and kind of segmented nucleus appearance, but rather than having the homogeneous cytoplasm, they have these really big pink granules. So they're quite distinctive. There's also a functional difference between heterophils and neutrophils. Heterophils lack the enzyme myeloperoxidase, which makes liquid pus. So instead, pus in animals that have heterophils is dry, crumbly, and cheese-like. So if you see a rabbit abscess, don't expect liquid inside it. Expect a clog of caseous heterophilic debris. You might also see polymorphonucleosides in mammals with eosinophilic granules in their cytoplasm. These are eosinophils, and they're deployed in acute inflammation related to parasitic infection or hypersensitivity reactions. Except in pigs. For some reason beyond the scope of this video, pigs love to deploy eosinophils instead of neutrophils. So this is a case of salmonellosis in a pig gut. And usually in other species like cows, you'd expect there to be lots and lots of neutrophils. But instead, the pigs are deploying their eosinophils. So we've got this kind of similar sized cell with a multi-lobe nucleus, but instead of the homogeneous cytoplasm, they have the granular cytoplasm of an eosinophil. And if we switch to this section of intestine from a sheep, we can see lots of intestinal parasites. So we'd expect there to be some eosinophils within the inflammatory component. And if we zoom in, here we've got some multi-lobed cells with pink granules in their cytoplasm. So these are eosinophils. In cows and sheep, the eosinophils are quite subtle, especially on scan slides. In contrast, horses have fracking eosinophils with these really big globules. That's a horse eosinophil with much larger granules. That's a better example with almost grape-like clusters of granules within its cytoplasm. So that's everything I can think of to show you about acute inflammation. If you have any questions, leave a comment underneath. Otherwise, I hope you'll check out the next video, which will be on chronic inflammation. Thanks for watching, and until next time, goodbye.